My name's Adrian Bauze. I'm a hip and knee surgeon at SportsMed SA. Anterior hip replacement surgery is a less invasive alternative to traditional hip replacement methods. Traditional approaches to hip replacement surgery involve the surgeon cutting through muscles either through the posterior or the lateral approach. The anterior approach enables the surgeon to make a small incision over the front of the hip and do the surgery without cutting any muscles. Anterior hip replacement surgery does have some potential benefits compared to more traditional techniques. These may include a smaller incision, less soft tissue trauma, reduced post-operative pain and more rapid rehabilitation. Studies have shown that anterior hip replacement surgery results in a lower rate of dislocation and slightly reduced length of stay in hospital. There are some hips for which the anterior approach is riskier than others, mainly due to the risk of fracture. There are particular anatomical variations of the hip bones that make exposure more difficult, as does obesity. It is very important that we do not place our patients at risk of fracture if their hip is unsuitable. I assess each patient on their merits and discuss the best option with each individual patient. At SportsMed SA, we have a number of hip surgeons performing hip replacement surgery through a variety of approaches, including the anterior approach. If you would like to make an appointment with one of our surgeons, please contact our team on 8362 7788 or visit our website www.sportsmed.com.au.